Firefighting has evolved significantly since its inception in ancient Rome. As the profession has evolved, so too have the tools and strategies to keep firefighters safe. Undermining that protection, however, is the development of myths that make the profession a little more dangerous for those putting their lives on the line. Our first myth is that smoke inhalation is the #1 cause of death for firefighters on duty. In fact, the most frequent cause for on-duty firefighter fatality is heart disease. Nearly half of all on-duty deaths are related to cardiovascular events. This number is only 22% among police officers, 11% among EMS workers, and 15% in the general population. Our second myth is that firefighters should only don their self-contained breathing apparatus, or SCBA, once they enter the fire and detect smoke. Wind conditions, as well as the presence of toxins that aren't visible on the scene, mean firefighters are always at risk and should connect their SCBA regulator before entering a fire. Our third myth is that gas detection systems will always indicate if firefighters should be wearing their personal protective equipment, or PPE. Multi-gas detection systems are only responsible for detecting certain gases and vapors, so do not automatically ditch your PPE. Our fourth myth states that a pump operator's exposure to toxic gases is so limited that there is no threat to their health and safety. Since winds can change quickly, it's important for all on-scene personnel to wear their PPE and have an SCBA handy. Repeat exposure without protection can lead to a number of neurological disorders, not to mention immediate and potentially dangerous side effects. Myth number 5 is that an air purifying respirator, or APR, chemical cartridge, fully protects firefighters during overhaul. This is false. It's not feasible to properly determine all of the potentially toxic gases that are present on scene, so an APR is not sufficient. The best practice when uncertain about surrounding environments is to use an SCBA.